Welcome to Courageous Conversations with Heman once again. I'm a student, researcher, and someone who spent years asking uncomfortable questions about who gets left behind when we talk about the justice. Right now, I'm based in London and a Chevening Scholar studying at the London School of Economics. But this podcast, it's rooted in South Asia, in communities. I worked with the South Asia Research Institute for Minorities, where we are committed to amplifying the voices of marginalized communities. Today's conversation is one I have been really looking forward to. Today, we are diving deep into the intersection of disability rights, caste-based discrimination, and the human rights topics. That are the often discussed separately, but rarely together, despite the fact that millions of people live at these exact intersection every single day. My guest today brings over a decade or the 10 years of expertise in the disability inclusive development, working with UN agencies, international NGOs, and organizations of the person with the disabilities across Asia and globally. So stay with us as we will explore how policy meets people, how resilience grow in the margins, and how the fight for dignity connects movements across borders. Thank you very much, Krishna Gahatraj, for taking your time out for this important and crucial conversation. How are you doing today?
I'm doing well. Thank you, Heman, for
Uh,
this opportunity.
Thank you very much. Let's start at the beginning. You have dedicated over a decade to disability rights and inclusive development. What was that one movement or experience that pulled you into this work? Was it something you witnessed yourself or someone you met, or a realization how human rights were being denied to entire communities?
Well, let me thank you first, Heman, for this opportunity to have this postcast conversation. Definitely, as you introduced me, my name is Krishna Gahatraj, and I'm from Nepal. I'm being based in Kathmandu, the capital city of Nepal, and it's been more than 2 decades that I have been staying here in Kathmandu and doing my own the professional career and all those things. Uh, just while going a little bit back to my the history childhood, I am a person with lived experience of disability, and I do belong to Dalit community. And as you are very aware that in South Asia, we do have a caste-based system, and based on this caste-based system, especially on the Hindu mythology, we are treated as a so-called lower caste people and untouchable. So I belong to that community. So just I was good when I was born, but when I was 1.5 years old, and I got polio, and because of that, my left leg is partially paralyzed, and that's why it is called poliomyelitis. And because of that, I'm living with the disability. I started my school career a little bit later at the age of 9 years old, and I was born in a rural part of the country. And when I admitted in the school, it was already too late for me. But since it was not accessible for me, and there was no chance to go to school on my own, so one of my elder brother who used to help me to go to school, carrying me on his back. This is how I started my school career. And when I started my school career, when I completed my school level education, then I came to Kathmandu after receiving one of the scholarship from the one of the social organization we used to support the student like us, who is good in school, the school education, but who is really from the poor background and needs financial support. I got that scholarship, and then when I started, when I did my past two education here in Nepal, in science stream, and then once I completed my plus two, and I started, meeting with many the people with disabilities from different caste and communities. And when I met them, and then I realized that, and many, the persons with disabilities who really wanted to have the higher education, and they were not able to have this. Sorry for that. And because of that, that really struck in my mind that why, we, especially the persons with disabilities, representing from diverse communities, especially from those most marginalized and underrepresented communities, are not being able to have this higher education. And this is something that really struck in my mind, and from where I started my career, especially to engage in this disability rights movement. So that was really a turning point. And one of the incident that I really want to share here is, definitely I used to stay in countryside where there was a rampant case of the caste-based discrimination, and also as well as the discrimination based on my disability. When I completed my school education, and then I had to go to the city side, to pursue my higher education. And when I went to city side to join the higher education, and I had to rent apartment for staying to do my study. And when I started searching the apartment for me, I didn't get that apartment because of my caste and as well as disability. And this is how it is interconnected. The overlapping, the identities really make me excluded. And because of that incident, and I didn't have an opportunity to stay in my the closest city, but I had to come to Kathmandu, and also I got in scholarship, and that has really enabled me to come to Kathmandu, and this is how I got involved. This is the really the incident that really inspired me to get in this disability rights movement.
That's really powerful, Mr. Kishan. I really understand the double discrimination these people face. While going through your profile, I get to know that you extensively worked with the CRPT, which many calls one of the most progressive human rights treaties we have. But I'm curious, when you are in the rooms with the government or UN agencies, what's the gap you see most often between and what the convention promises on the paper and what's actually happening for the people with disabilities in their daily lives?
Yeah, I mean, you see, when I started engaging in disability rights movement, being myself a person with lived experience of disability from Dalit community, and I got engaged with so many, the policy level conversation, and as well as also building my own capacity, knowledge, and understanding about disability rights, not just only from the movement perspective, but also building my own knowledge from theoretical and human rights based approach. So Nepal has been the state party for CRPD, the Convention on the Rights of Persons with Disabilities, in 2010, and after ratifying all those processes. And when I went thoroughly with this CRPD, and CRPD is the real true, the instrument, the tool for us to have a whole, the transforming the movement from charity and medical based model to the human right based approach. This is one of the powerful tool aid for us, not just only in Nepal, but the globally. And that is the, main, the International Human Rights Treaty who really recognize us as a human being. So this is the fundamental principle of CRPD. So as you said, when I, got an opportunity, when I get an opportunity to stay with the government stakeholders, government bodies, and other UN agencies and other development partners, it's been more than a decade. I think it's been almost a decade because CRPD came into action in 2008. Now we are at the time of 2025, so almost around a decade, more than a decade. So when I see this, the major gap, what I feel is still there is a huge gap in understanding the disability from human rights based approach, because the convention on the rights of persons with disabilities fully defines and understands and conceptualize the disability from human right based approach, completely completely transforming its traditional perspective from charity based model to the medical model to the human right based approach. And though the country has been already state party, and though the other development partners and even UN agencies who are saying that they are working in aligning with the CRPD, but the true understanding of the essence and spirit of this CRPD is still there is a huge gap, and that is the major gap that I always feel. So I mean, definitely based on. I could give you some of the also very good examples that we have to make it more clearer, because even our country being a state party of the CRPD, they say that they are very much progressive in terms of ensuring and promoting the rights of persons with disabilities by promulgating different disability related laws, policies, and programs, right? For example, we do have a Disability Rights Act which was promulgated in 2017, and they say that this is one of the very much progressive act for us, and which completely aligns with the principle and spirit of the CRPD, as it says, nothing about us without us. But in practice, and even by principle, why they are far from the CRPD's core essences, they are still categorizing the persons with disabilities based on their types of impairment. So when you see theoretically and by principle also, if we categorize the persons with disabilities based on their types of impairment, this is completely a medical model. Okay, and it's still their mindset is based on the charity based model, and that's how they differ from the core spirit of the CRPD. So this is one of the very good example for us, and especially I do depend on that. Why, if they accept CRPD as a major human rights treaty, and this is, I mean, that's the CRPD recognized persons with disabilities as a human being, and why they are categorizing people with disabilities on the basis of only types of impairment, meaning that if we take the categorization of persons with disabilities based on their only one type of the identity as an physical impairment, and that does not count other identities that really associate with the people from where they do belongs, and that really discriminates, that excludes them from the recognizing the diverse identities, and that's how they, this the principle, push those people with disabilities at the margin of the community. So this is the major gap that I really find in Nepal, and for that we are still fighting on that. The policies has to be fully aligned with the CRPD's core essence and has to take into consideration of the diverse identities of an individual.
Yeah, that's really insightful, Mr. Kishan. Recently, you mentioned about the major gap is understanding the disability with human rights perspective. I would love to deep down and understand, especially in South Asian context, where caste and disability intersect. Can you please help our listeners to understand it's actually like for Dalits with disabilities? How do these two identities compound the discrimination they face, or genuinely what kind of discrimination Dalits face back in Nepal?
That's a very wonderful questions, Mr. Heman. Definitely, since I do belong to the same community with disability, and I do have my own lived experience, and if I have to give a overall picture of the South Asia, especially we persons with disabilities from Dalit communities have been really facing the intersectional barriers in every day of our lives. How does it matter to us? Let me share. There are plenty of examples, but the one very shared part for us is there are no such the written documents. There are no such the research, formal research that have been already carried out in terms of this sector, and because of that we do have a very limited and no data evidence and literature that we could exemplify, or that we could amplify more. But we do have the stories, we do have that lived experience. Caste and disability really intersects to each others. So when we talk about Dalit people, as I said you in my introduction, Dalit people are mainly treated as, they are regarded as so-called lower caste people based on the Hindu mythology. We do have a caste hierarchy in the social system, and the social structure, what it does for us is we are regarded as so-called lower caste people, and that's why we are always treated as untouchable people. So let's see, we are the people, but when the society, the community people who are regarded as so-called higher caste people, they do not include us. They treated us as untouchable people. So this is one section. But when we see again from the disability lens, from the same community people, even the persons with disabilities face more exclusion from different aspects. Let's say if we see it from the attitudinal perspective, the community, when people see with different types of impairment, they automatically comes up with prejudiced mindset and stigmatization that this might be because of the past birth sin, or they come from the more the perspective of ableism, whether they can do or can't do. And also they relate the persons with disabilities with different the cultural and religious beliefs. Because of that also the persons with disabilities are discriminated and excluded from entire the private and public sphere. So now I want to composite both of these identities together. If we see the people with disabilities from Dalit communities, so they are discriminated more than any other people because of their caste and their also the disability. So this is really, really a very, very worst situation for us, not only in Nepal but in the entire South Asian region. And till now, we don't have such the organization that really amplifies this voice from the intersectional perspective. So let's see, one aspect, one group, we are searching for our own space and recognition even within the Dalit rights movement. When we see the Dalit rights movement in South Asia, it seems one of the older, the very having a long history of emancipation movement from the caste-based system practices. But when we see our space within this whole Dalit rights movement in South Asia, we We don't find anywhere us, even no single persons with disabilities from our communities, and even our elders, even our leaders from the Dalit communities, they are recognizing us and our voices are raised. So this is one fact in within Dalit community. And even if we see the disability rights movement in South Asia, from the diversity perspective, the whole disability rights movement in South Asia is fully dominated by the impairment based model. So, the South Asian disability rights movement always considers the only type of impairment as only one identity, and this is how it is leading the whole movement. But while having this, so we don't find our participation, representation, and as well as our recognition anywhere. So, we are really marginalized and excluded from overall this movement, whether we say it Dalit rights movement and liberation, or whether or we say the disability rights movement and its emancipation, or even we can take an example of the feminist movement, which seems to be very much strong in South Asia, right? So none of these, the social movements and human rights movements are taking into consideration of us. So this is the very better fact for us, Heman, to be honest and to share with you.
Yeah, I totally understand that. I really like the terminologies that you used, Dalit rights movements or whether it the disability rights movement, which brings me to my next question is that while when you work with communities like Dalits, how do you actually practice right-based advocacy? This is something you are I mean, you're fighting for the inclusion and you are pushing against centuries of social hierarchy that you mentioned about the Hinduism that exist in the Hinduism and the power structures. What does that work look like on the ground?
You see, I mean, our fight mainly for is not just only for inclusion, but we really want to have the transformation of the society, from this charity-based model to the totally the human rights-based approach, that every individual of this world to be recognized, acknowledged, and dignified as human being. This is our ultimate goal. So when I mean just when we say about our collaboration or the allies building with the Dalit rights movement for our rights, definitely we are working very closely with the Dalit rights movement. For example, how I want to share the stories, just to give you a very brief background about Dalit with Disabilities Association Nepal. So I have already worked with the disability rights movement, associating with different NGOs and also organization of persons with disabilities. And also I did work with many, the international organization who works for disability, human rights, and inclusion. I have already worked on that. But finally, what I realized is there are so many persons with disabilities from our communities who are still not recognized, who are still not counted at that they are there and who needs to be brought in the mainstream. So that factor actually made me, to realize and then take some initiative to establish the organization and to get organized and make our collective voice be raised, to make counted, to give us recognition. This is how I started. I founded the organization called Dalit with Disabilities Association Nepal, and this is the only one organization till now. If from the South Asia, I haven't found any organization in any other countries that really specifically works and raises voices of the Dalits with disabilities. So, with this background, if I have to give some example that how we are building the collaboration, and definitely, as I said previously, our first work is with our Dalit rights organization. So here is a Dalit rights movement. So we are building collaboration and solidarity with them. So we, in many ways, we have invited them and we have made our issues and agenda to be heard. They are sensitized and they are really asked for joining hands together to make our voice louder. So in a two way, one way is definitely we have made them to include us in their own organization and movement, especially giving the recognition as Dalits with disabilities, who are the most left and underrepresented groups within the Dalits communities. In another hand, also we are taking them as our backup force, right? When we ask for our rights with other communities, let's say disability rights movement, then the Dalits movement always be with us as a guardian for us. They are this house for us who safeguards us to fight for our rights. So this is how we are building a collective, the movement and power together. And but if we go with the disability rights movement, we are always putting our voice strongly to keep us recognized from the intersectional perspective, because we do have that intersectional identities. And one of our very strongest voice with the state is to amend our existing disability right acts and making us recognized from the intersectional perspective completely, leaving the oldest, the conventional model of the medical approach. That is what we are doing, and we are asking our state to be completely, obliged, because the state has an obligation to completely follow the CRPDs, what it says. So the state has to completely apply the human rights based model of disability, and that could only recognize us together. So this is the two way that we are working, and even we are not only focusing within this two domain, but also we are collaborating and making our, joint force, collaborating with other different feminist organization, youth-led organizations, and also other marginalized groups. For example, in our country, Nepal, we do have Madhesi people from Madhes region, who are always ignored and, siloed from the state based on their region and also the race. So we are building the collaboration and allies with them and solidarity, and that is how we are making our voices stronger and then working together to make us actually heard by the state and different development partners.
Definitely, and those are the powerful structures that do not appear during the crisis. In fact, they are the one get worse with the time. Despite progressive laws and promises of the 2015 constitution in the Nepal, still many Dalits in Nepal still experience systematic exclusion in education, employment, and governance. If you could dismantle one institutional barrier to accelerate real equality for Dalits, what it would be and why?
Uh, you see, for us, especially for Dalit people with disabilities, or let's say the whole Dalit community, it's a structural barrier actually. It's a system. That system has, deliberately excluding us from all those opportunities. For example, having access to the education, having access to the other, I mean, just let's say health services, facilities, and all those. So, what I really want is to end the caste based discrimination, to end the discrimination based on disability. We do have also policies, many policies. Even right now, the we do have a new constitution, and the new constitution has clearly provision us the rights from disability and Dalit perspective. But also, having said that, these are not being effectively implemented in practice, and because of that, we are still facing, the exclusion. We are still experiencing full the marginalization from the society. So what I would really emphasize is, based on that policies, acts, and constitutional provision, we need to have a very transformative systems and mechanism that truly reflect those provision into action. So I mean, we could see so many the duty bearers less commitment to implement those existing provision into practice. So that should be a very robust, system and a mechanism to make this implemented. So this is what I think from my perspective.
Okay, since we have talked a lot about the structure and struggles, but looking ahead, what kind of solidarity do you believe will truly shift the ground for Dalit communities in Nepal in the years to come?
I mean, for me, what I really envision, or just what I really expect is, the collaborative effort, the solidarity among all the marginalized and socio-economically, politically, and religiously excluded groups. We are not the only one group, in our society who are only marginalized and discriminated. There are other groups. When we see from the gender perspective, definitely there are women who are still not recognized as a human being and treated as a, treated as a the real true the appendage of the society that needs to be treated on an equal. And similarly, also when we see the youth and also the other religiously minority groups. For example, in our country, we do have a very small number of Muslim people, but they are not well recognized and mainstreamed. Their agendas are not really included in a real sense. So there are also other so many communities and groups. For example, I could take an example of also LGBTI community. I mean, those people, especially who are from the sexual and gender minorities community. So we all, the people with disabilities, and also from the Dalit community, women, and also let's say farmers, and those who are even never counted as human being of the society, all of we need to be, need to come together to make our joint effort and to claim our rights with the state. I think that would really make louder. And this is the national content, but when I see it from the South Asian regional perspective, definitely one of my strong demand with the Dalit rights movement is now Dalit rights movement also has to be intersectional, because completely Dalit rights movement is dominant and led by all the men, Dalit men, and this is not right. This is not the right, that the way that we are heading towards. So we need to diversify our one movement reflecting us. So we need to recognize those communities, those people, those caste people who are not included eight in our movement. So they need to be brought together and make our movement more stronger. So this is for the message to the Dalit rights movement in South Asia region. And but equally, I would also like to give the same voices to the disability rights movement in South Asia. The South Asian disability rights movement also has to see the disability from diverse perspective, from the human right based model. The disability is not only the one identity of an individual, because we every individual has the multiple identities. So these multiple identities has to be well recognized and respected, and that could only contribute to accelerate the movement in the region. So I think this is the voice for even disability rights movement in South Asia, and that's how we could build this solidarity and really move forward for our rights, and ensuring our participation and representation on an equal basis with others.
I hope your voices reaches to these communities. This brings me to my final question, and I always like the end on this note. After 10 years of doing this deeply challenging work, what still gives you the hope? If someone is listening today wanted to understand what Dalit rights movement in the Nepal truly stands for, I mean, it's a heart, it's struggle, it's hope. What would you want them to understand or remember about it?
I mean, you are taking the time frame of 10 years, so I'm always hopeful and optimistic with the social rights movement. After a decade, after 10 years, I fully believe, and I do have a strong hope that the future will be very much inclusive, dignified, and also, respected to each other. So that's what my hope is.
Yeah, thank you very much. I mean, what a powerful conversation, Mr. Kishan. Thank you very much for sharing your insights, your experiences, and honestly, your hope with us today. I think what strikes me the most is how you have shown us that human rights are not just abstract concepts. They are real. They are about the real people living with the real intersections, facing real barriers, and that dismantling those barriers requires all of us to think beyond our silos and build genuine solidarity. And what stayed with me today from this discussion is the idea that real change happens with most marginalized lead, whether it's Dalit with the disabilities, women, or the gender at the intersection of the caste, or the communities reclaiming their voices in policy making. To our listeners, thank you for tuning into Courageous Conversations. If today's episode made you reflect, question, or want to act, share it forward. Let's keep these stories alive and the dialogue growing. Thank you very much, Mr. Kishan, for taking your time out once again for this conversation.
Thank you, Heman. Thank you for this opportunity, and always look forward to see you. The more conversation in coming future too.
I would love to have another podcast or conversation with you in the future. Until next time, I'm Heman Das, and this has been Courageous Conversation, where we keep courage at the center of every conversation. Thank you.
Thank you. Bye bye. Have a good
Bye.
day.
You too.